Hi everyone, my name's Andrew Paul, and I'm doing my presentation on community mental health in Portland, Oregon. Um, I guess to start, I just wanted to kind of go over background of what community mental health is and where it started. It began in 1963 when John F. Kennedy signed into law the Community Mental Health Act. And that was something that really laid a foundation for what community mental health would look like, and it really changed the way mental health was being administered, which at that point was pretty much solely in hospitals and asylums. It was designed to decrease the need for more costly inpatient care that's delivered in hospitals and asylums. And one thing that I was impressed with was how large the umbrella really is for people who contribute to community mental health. You have everything from psychiatrists, psychologists, community psychiatric nurses, social workers, occupational therapists, case managers, administrators, law enforcement, school counselors, teachers, volunteers, and so there's really just a lot of people that pour into helping out with community mental health. Um, when I researched the providers for community mental health in Portland, Oregon, there is an abundance of them. The Multnomah County Community Mental Health page had like 28 pages of providers that were serving any number of cultures and um, different specialties, the LGBT community, transgender community, substance use, mental health, behavioral issues. So there's just all kinds of stuff out there, which is really cool, I think, for our generation that it is so much more available for us. I don't think that the system is perfect by any means, but I think that there are a lot of options for people out there who are really looking to get help. Um, One of the first things I noticed was the that's kind of unique to our generation also is all the crisis services that are offered really in anywhere now. A lot of these lifelines or hotlines are nationwide, but some of them were specific to Portland. But you have lifelines for everything from drugs and alcohol, veterans, suicide hotlines, child abuse, general crisis help, youth hotlines, women's crisis lines, and so there's um, a lot of different ways to get a hold of someone 24/7, either on the phone or over text, and be able to talk to someone about what's going on, which is something that wasn't available in the past, and um, is, I think, very beneficial to helping people out. You never know what time of day a crisis is going to happen, and these kind of help serve that area. As far as clinics and hospitals in the Portland area, I'm probably going to say this multiple times, but there is a lot of them. Um, One of the main ones, I think, or bigger ones, is Providence Behavioral Health. They offer 24/7 psychiatric triage and services. Multnomah County health clinics are all over Portland, and they provide care to uninsured and low income residents. You also see a lot of family member support, education, and advocacy groups that are around the community. The Dougie Center is in Southeast. It offers grief support groups, classes, resources for peers and family members that either are struggling with mental illness or know somebody who is. Um, there's a Straight Depression and Bipolar Support Alliance, and those are peer led support groups in the Portland area. One thing that I really thought was kind of cool is a support group called Folk Time, and they do mental health recovery through art, music, lunch, games, and other fun activities. So I thought it was a pretty unique take on administering mental health, besides the one-on-one or group counseling that's pretty generic. They have specific programs and providers for elderly persons, for juvenile treatment. There was a bunch of different inpatient and outpatient services. One of them is Northwest Behavioral Healthcare Services, and they do residential services for youth ages 12 to 17 with dual diagnosis of substance abuse and behavioral health. There are veteran specific programs, one of which I thought was interesting is the Returning Veterans Project, and their free confidential mental health and health care for post 9/11 veterans, service members, their families, and that serves all of Oregon and Southwest Washington. Um, there's also Portland Veterans Center, which is confidential and free veteran support. There's no medical advice or information given when veterans go there. Treatments for addiction, again, there's an abundance of these that fall under the community mental health category. One of them is Portland Treatment Centers, and they're actually a daily dosing clinic where they're doing maintenance for detox for individuals that are trying to overcome dependence on opioids. They also offer group and individual counseling. Salvation Army is a pretty popular one. It's 6 months to 1 year, and they do alcohol and drug rehabilitation program that has a work therapy component and also does group and individual counseling as well. For low income counseling services, just kind of your traditional one-on-one or group counseling, there were 28 pages, I think, of different providers in just the Portland area, and that ranged from everything from substance use, mental health, behavioral health, pretty much any culture that you can think of. And we'll read through some of them that were on the list for culturally specific: Cantonese, Mandarin, Taiwanese, Korean, Vietnamese, Spanish, Portuguese, Russian, German, American Sign Language, Arabic, Farsi, French, German, Italian, Ukrainian, and it goes on. So there's literally a provider for just about anything in Portland, which is awesome. It's cool to kind of see that that our communities are attempting to do something about mental health, and to see that they continue to work together to try and provide people needing those services. The other thing that I was impressed with is just how many different people, as we talked about earlier, go into providing support for community mental health. And you see that not only do psychologists and psychiatrists and therapists play a part in community mental health, but so do law enforcement and teachers and volunteers and administrators and case managers, and all these people are kind of part of the system that makes up community mental health. Thank you.